Hello and welcome to the 130th episode of the Hope Illuminated podcast, where we share powerful stories, science, and well-being strategies. Here, isolation and despair can be defeated and a passion for living rekindled. No flashlight required for our journey, just followed up listeners ready to gain guidance from myself and our expert guests. Today, our conversation is going to be on healthcare workforce in particular, and how they are or are not taking care of their emotional well-being. Now, many of you who have been involved in suicide prevention nationally and internationally know that zero suicide is a thing. It's a movement where healthcare systems are aspiring to eradicate suicide to the best of our abilities and to improve our systems and training and patient care so that no one dies in isolation and despair. And the better that we're able to do that, the more lives we're able to save. It's something that I know many of us are very excited about and proud to be a part of. But what sometimes gets neglected in that conversation is, what about the healthcare workers? And that's the conversation that we're going to tackle today. So today I have with me Christopher Wojnar, who is going to introduce himself in just a second, but a proud member of the board of directors for United Suicide Survivors International. We met at the Living Beyond Suicide Summit in Colorado a number of months ago, and he is also on our workplace suicide prevention and post-vention committee. So he is speaking the language that I love with all the things that are important to me. And we're going to become fast friends. Christopher, welcome to the show.
Oh, thanks, Sally, so much. And what an honor to be on the 130th episode. It's a good flat, even number. So I love it.
It's a nice number, that's for sure. So excited that you're here, Christopher, and so excited for the many ways that we'll be partnering in the future. Tell us a little bit about what you do every day.
So yeah, I'm a professional registered nurse in the intensive care unit at a large hospital in the state of Wisconsin. So, I was drawn to nursing after completing an education in firefighting and wanting to follow in the footsteps of my father. And, after many years of trying to get on a full-time fire department, I was with my now wife. We just started dating, but I told her, I said, "Hey, Katie, I'm going to quit my job and pursue nursing for the first time in my life." So being a nurse has allowed me to positively impact as many colleagues and patients as possible. So, we play crucial roles in patient advocacy, education, and healthcare delivery, impacting the whole person. So we form strong connections with patients and families. And, there's been so many opportunities for me to get involved with so many different initiatives. And I am a psychiatric mental health nurse practitioner, future provider. And it's just been amazing to get involved with this, with mental health in general. So.
Well, thank you for your passion and your service to the community in this way and for all the lives that you've saved. Tell us a little bit about how you got here and what brings together for you a combination passion for nursing and for suicide prevention.
And believe me, for most people too, it takes a while to get to a spot where you can share your story and things about yourself. And it wasn't anything different for me either. So, as I share a deeply personal journey, it's definitely one that has shaped not only my life, but also, an unwavering commitment to mental health advocacy and suicide prevention. So, I'm very honored and blessed to sit before you. And I hope that sharing my story, we can collectively inspire change and foster great understanding around these critical issues. So, I have to rewind, though, to the turbulent times of my adolescence, a period that was marked by a roller coaster of emotions and experiences. So between the ages of 14 and 18, I faced challenges of being overweight and bullied. This was compounded by 4 attempts to end my own life. The emotional pain was so overwhelming that at the time, I truly believed that death had to be a better alternative than the relentless suffering I was enduring. Yet here I am today, profoundly grateful to be alive. It was after my 4th stint in the hospital at the tender age of 17 that a revelation struck me like a bolt of lightning. And there was a particular journey, one, that's embarked on after unexpectedly making it through an attempt to end your life. And I think numerous emotions rush through you, and those are relief, sometimes numbness, disappointment, anger, shame, guilt. being embarrassed, feeling lonely, regret, fear, and just confused. In a moment of reflection while inpatient, sitting in that hospital, I whispered to myself, I said, self, maybe you're supposed to be here. And this newfound perspective just blew my mind, and it eventually became, the catalyst for a transformative mission to turn personal suffering into strength and extend a compassionate hand to help others grappling, with a similar battles. So I made and still make the conscious choice to practice healthy ways to survive and thrive, permanently removing suicide from my coping arsenal. So the impact of near-death experiences from suicide attempts and, the devastating loss of many friends, family, and healthcare colleagues to suicide has fueled my determination and, to make a positive impact on as many lives as possible. Joining my current hospital in March of 2018 was a crucial point in my journey, a turning point, if you will. It was brought, many unexpected challenges. So I reconnected with a childhood friend, a fellow nurse that I worked with who had weathered, similar storms of mental health when we were younger, and we had plans to catch up, play guitar, and relive old times. And those were ultimately tragically shattered when he died by suicide in August of 2018. And his death was followed by another nurse from our hospital who died by suicide just a week earlier. So the heartbreaking reality of these losses, coupled with unsettling comments from colleagues at his funeral, really ignited a fire within me. And it was, really to teach others and to provide foundational education to colleagues on identifying struggles within themselves and others. And, this led me to peer support as an evidence-based intervention within the hospital setting. And the determination also led me to collaborate on developing and implementing a regional peer support program across 27 sites of care.
Woo! Wow.
Yeah.
That's an incredible journey. Thank you for sharing a piece of your story. And there's so many things that I'm wanting to follow up on. So the first thing that you said is that storytelling is a journey. It's a personal journey. It's not one that everyone needs to take, should take, or is expected to take. And it's one that unfolds over time at different points on your journey. You see things in different ways. And so can you just talk a little bit about your storytelling journey and how you got to the point where you got to just now, where you're able to share a little bit of an insight into, the passion that drives you today?
Well, in September of 2018, which was a month after the tragic loss of, the two colleagues, I found myself sharing my story for the first time publicly to an audience of 80 medical residents during Suicide Prevention Month. This vulnerable act marked the beginning of a much broader initiative, as I proposed the creation of a hospital-wide teammate well-being committee and became aware of zero suicide initiatives being piloted within our hospital, our healthcare system. And I think the storytelling journey, what I started to find and feel was that, many were resonating with it, because I think in the field of healthcare, especially within nursing, there's a don't talk, a don't tell type of mindset. And there's a fear that if you share something, a struggle or something you survived and persevered through, that can mean that you're not able to do your job or that you're weak. So it really takes a lot of courage sometimes. And obviously learning how to do it safely is another big thing, not sharing the specific details of a particular, event or things alike. So I think, giving yourself and educating yourself too on how to share the story is important, but also just continuing to do it also breaks down that stigma and allows others, to feel that they're not alone as well too. And it encourages others to share their stories too.
That's right. That's right. Yeah. So it is a process of self-discovery in that, as you figure out what the narrative is, what is my story? What is true for me? Your story also highlights this concept that Dr. DeQuincy Lezine calls post-suicide growth, that there was that epiphany moment where you said, I guess I'm supposed to be here. And I've heard this from a number of people who've survived suicide attempts. There's this moment then and then the corollary is, so what do I make of this one wild and precious life that I have? And then often there's this process where people start to find ways to find hope through action and to turn their experiences of despair, that wisdom that comes with living through that, into ways of helping other people. Can you articulate a little bit more in addition to what you've already said about what that post-suicide growth period was like for you?
And I think once you come to the realization, and believe me, I definitely my spirituality is a very big part of my journey. And I think when you go through experiences where you shouldn't be here, but you are, you really have to try to find meaning within that. And sometimes it just can't be explained. I shouldn't be here, but I am. So, hey, let's do something with it. And I think a lot of people can sometimes be very hard on themselves too. Like, okay, my life has been preserved. I have to do this grand thing or be involved with, and do this remarkable, save the world type, but you don't have to. I think one thing that somebody told me that makes a lot of sense is, Chris, you just being here maybe is enough. And
Mm-hmm.
that is also true within itself. So, I have to remind myself to be kind to myself, and that, I think when you're looking for a purpose or a meaning within, surviving an attempt to end your life, to really just continue to be kind and to not force things, I think is the big thing as well too.
Thank you. The other piece that I wanted to just address was that, after losing two colleagues back to back, that the internalized bias or stigma of the healthcare system becomes readily apparent. I mean, it's probably percolating before that, but when there are these incidents and tragedies, sometimes it rears its ugly head in ways that just compound all of the challenges that those kinds of situations bring. And your situation is not an isolated one. We hear this a lot of times in a lot of medical settings, in a lot of helping roles, where we have maybe othered people, like we're the helpers, we're the professionals, we're the experts, we're the ones who do the things. And then there's the other, the ones that are being helped, that have the conditions, that have the struggle, and we are not them because we need to be competent. I get that. I certainly had that, for a good chunk of my career, until probably I had my first episode of major depression and then lost a brother and lost a good friend. And I was like, oh, it's a we. We're all in this together. And yeah, even our best training and skill sets can't prepare you for the we moment. I just want you to kind of unpack that for a little bit about what it's like to live in that, where you're very aware. And, I think some of those biases serve a purpose about boundaries and so forth. I mean, I don't think they came out of the blue to be so judgmental and create such barriers for people. But I do think there are a lot of places where they're causing harm for the workforce and probably for the people that we're trying to help. Right. So can you just talk a little bit about that?
Yeah, I think when it comes to boundaries, they are, and what you mentioned too about boundaries, I think is important. And although there are boundaries, I don't think things are always black and white, right? And it's difficult to think in that gray space, and that, and the common thing and a common thought, and I know a common thought that I can resonate with is that, if you reach out for help, it's a sign of weakness, or if you share something about yourself that, that it's a bad thing, or that you, like I said, that you can't do your job, or that you're not able to be successful, or things along those lines. And I think a lot of times what happens, and we have to also acknowledge, I mean, the fact that there's still stigma amongst providers, and especially even in mental health. Like if two providers, if one shares something, discloses something about themselves, that other provider may still hold stigma towards that person. So it's like we have stigma even within and between providers that we're trying to break down and reduce in those that we're serving, so that we can have them reach out for resources and access things. So I think, again, though, what happens is that there's a lot of fear about encouraging, nurses in particular, other healthcare providers of sharing their stories. And that could be organizational fears, that could be individual fears, intrinsic. So I think a lot of those things are just ways, and why it's so important to share your story and to share things, to break that down and show that it can be done. I'm still sitting here. I've shared my story. I'm a professional nurse. I'm a dad. I'm still able to do all the things, as you said, while still, surviving and thriving and being the best I can be. And that's what's important.
Yeah, and Patrick Corrigan's research on stigma says that's really the only thing that we have been able to show that actually reduces stigma is when we have these relationships with people and really get to know them as another human being, not an other. One more thing that you brought out, well, there's probably 20 more things, but the next thing that comes to mind that I wanted to have you elaborate on, you said it in passing, and I'm like, oh, I'm grabbing that thread, pulling that back. I took suicide as coping kind of off the buffet. A lot of people don't understand that suicidal thoughts in and of themselves, not bad, human, they're human. And they are often kind of this wake-up call, and they are often used as coping. But if you haven't experienced it, then that's a little bit of a difficult thing to reconcile. Can you talk about what you meant when you said, I'm going to take suicide off as a coping
Yeah,
mechanism?
yeah, and I think you're exactly right. And for me, it was important for me to just not so much eliminate the word suicide out of my vocabulary, but when, you're considering all of the tools in your toolbox, and just not having that one as an option to even consider, I think was very important for me, because that was the only option that I felt was available to eliminate the pain that I was feeling. So overall, I learned that there are many other adaptive ways and other effective ways of handling stress and handling, the various emotions that you're feeling without resorting to, the actual act or the attempt of ending your life. Now, not to say some people do live with suicidal ideation, and, when stresses get higher, sometimes those intrusive thoughts or those passive thoughts can just simply come up. And that's where it's important to, again, resort back to, well, this is just not an option. Yes, I validate and I hear and I know I'm experiencing these things. And just reminding yourself, well, why are you alive? What are you working for? And so not completely just shoving them under the rug, but still, living with them, but also surviving and thriving through them, I think is where I just say I want to eliminate that as even being an option.
Yeah, I have my own coping thing around emotions that are uncomfortable that I think is probably the same. I just thank them for showing up. Thank you, anger. Appreciate you showing up. You are telling me that I need to go address something in this relationship right now because I'm very, very upset. And
Yes.
as long as I fester in this upset, it's not going to get better. I've got to understand where it's coming from, and then so figuring out the functionality of the emotions, functionality of the suicidal thoughts, like what purpose are you serving for me right now? And then how can I get to another way to meet that need? I think is kind of an interesting and important way to think about why these things, why we experience these things, why our body is generating these kinds of responses to certain
That's
situations.
It's kind of that internal emotional thermometer that I love to have, and that's when if somebody is experiencing, suicidal ideation, well, that's a sign that your thermometer is getting to a spot you don't want to be. So I think it's important, and I do this all the time, is I'm constantly trying to analyze and assess where is my thermometer, where am I at, how can I continue to get back into, the green zone and not so much in the yellow and red all the time. So.
Yeah, excellent. You also brought up peer support, and I am infatuated with the whole idea of formalizing peer support in a lot of our workplace systems for many reasons. It helps the helper to help others. It also is a lower threshold for access that has, all of these amazing benefits when done well, and on and on and on. And yet there's a lot of workplace systems that are afraid of this approach, and resistant to it. So can you talk a little bit about your success in moving this peer support for nurses, statewide movement forward? How did you gain such traction and get such buy-in?
Well, it started after my friend's passing in 2018, where my VP and CNO, my Vice President, Chief Nursing Officer at that time, supported me to fly out to Johns Hopkins, and I actually attended the Maryland Patient Safety Conference and was a guest of Dr. Albert Wu, who coined the phrase second victimization. And Johns Hopkins just been doing some amazing work in their peer support responses, and their program's called Resilience to Stressful Events. So that's kind of like a peer response where a stressful event comes up, and there's actual trained peer supporters who are dispatched to that particular instance. So that was something that I investigated, and ended up coming back and proposing to our at that time our hospital systems vice president, chief nursing officer. And eventually, though, as we were integrating with Wisconsin and Illinois, the partnership and collaboration with the Trauma Recovery Center allowed us to create a peer support program within our own hospital system, and that one's called Together as One, and that one's just been very successful. It teaches a trauma-informed approach, the stress response, how to identify struggle within yourself and others in simple ways, to provide support and refer to resources. So there's other hospital systems that have been doing great things. Missouri's For You program. So this experience and this work and the success helped me when I did get connected with a group called the Wisconsin Peer Alliance Network that was mainly focused on providing peer support to substance use, nurses with substance use. So I am very honored and blessed to be an elected council member of the Wisconsin Nurses Association Workforce Advocacy Council. And this work has helped connect and help build and expand that peer support network from the Wisconsin Peer Alliance Network to the entire state of Wisconsin, focusing mainly on nurse, mental health, and well-being, all realms of it.
Excellent. What a great momentum story. So we'll put some of these examples of successful peer support programs and the Johns Hopkins work into the show notes for people who want to dive a little bit deeper. You're also involved in something that I get very excited about, which is zero suicide. Can you talk a little bit about what those experiences have been and what you've learned so far?
Yes, and after, just like Chris fashion, I have an all-in approach. And, after my friend's passing, and, I started to learn a lot more about zero suicide and the framework. And I learned that actually we were piloting and rolling out this framework in one of the hospitals in our health system. So, I got connected with this work, and of course learned so much about it. And as a frontline nurse with lived experience, it's been an honor to actively collaborate with our organizational leaders to make a meaningful difference, within our workforce. So I remember saying, though, and hearing that, this framework is mainly for our patients. And I remember very vividly saying, hey, I understand this is for our patients, it's focused on that, but we have a problem within our workforce. So that work kind of
Before we go any further, just for our listeners, can you just define the Zero Suicide Initiative for those who haven't heard about it before? Because I think people get like zero. They get tripped up a little bit on the name, but then also just like from your perspective, what is it all about? What is it?
And that's where I think it is controversial, and some people, really resonate with zero suicide, and others, have a harder time with it. But I think, there has to be only one goal, and that is zero, because one suicide is too much. And ultimately, zero suicide framework and the way that I view it, and from the definitions, is that it's ultimately a framework that says that all suicide deaths within the healthcare system, so a person who is receiving care in the healthcare system, that all suicide deaths are preventable. And that's kind of the framework, and it's a cultural buy-in from many key stakeholders, and it's really a commitment to zero suicide as the only goal.
Yeah, exactly. There's a lot of different components that go through it. Some other day, we'll cover it in depth in several different ways, but it is a systematic, long-term cultural change effort to reduce suicides to zero in our healthcare systems. And so you got to be a part of it, and you said, but wait a minute, what about the workforce?
Yep.
Yes, and that's kind of the conversation that we're having now, which is, again, super thrilling from my standpoint, is if we can connect the dots to this really important global movement around empowering healthcare systems to continually do better in this space, and linking that with, and also don't forget the people who are doing the work. They also need support. What are your thoughts on how the tie the dots together?
Well, what I didn't mention is that, not only the two nurses that we had, and one being my friend, but we, from August of 2018 to about January of 2019, we lost, I believe it was like 5 or 6 healthcare workers to suicide. And that was just in the state of Wisconsin at that time. So this is prior to the pandemic too. So it just continued to share a light on the need of the focus on our workforce. And, the framework for zero suicide, I think, is extremely relevant to the workforce and can be applied to the workforce. And, things like universal screening for workers, implementation of like interactive screening programs, ways to do it confidentially and, anonymously. And I think there's all the realms, or I guess the tenets of it that can be applied directly to the workforce. So it just takes that extra step to do that, but it can
Yeah,
be done.
yeah, it's great to see that expansion, that a healthy healthcare worker is going to have a better impact on the community that they're serving in. So,
Well, the same could be said for leaders as well too, because it's a very novel thought, but it's also complex. If we take care of the workers, if we take care of the nurses or the people who take care of others, that's going to lead to better patient care, right? Well, if we take care of the leaders and support the leaders who support the nurses or the healthcare workers, that's going to have a biggest impact on the people we serve.
all right, excellent. I think we've made the case. This is
Nice.
needs focused attention. Let's shift now on a little bit of what we know. What's some of the research that's got your attention in this area of nursing and healthcare workers and mental health and suicide prevention?
Well, this whole initiative with zero suicide and the deaths by suicide, that, I wanted to learn, what was happening across the nation. And this led me to work by Dr. Judy Davidson out in UC San Diego. And she initially it came out with a call to action, if you will, called Nurse Suicide Breaking the Silence. And, never in the past has there been any research that has actually put a number to the number of nurses that have died by suicide. And, the shocking revelation is that there's been 2,374 nurses that have died by suicide from 2007 to 2018. And, whenever I tell anybody that, they're just always astounded. And it just continues to show that we need to talk about it more and to bring that to light. So her research after that fact, though, also utilized the CDC's National Violent Death Reporting System and that data set to continue to look at the narrative data as to what were some of the correlating or statistical significance, and what were some of those things, some of those trends that could be identified within that research. So, and then Dr. Davis at the team at University of Michigan School of Nursing, published the most recent analysis that showed that between 2017 and 2018, there was like almost 800 nurses that died by suicide, which shows that the number is just continuing to increase year after year.
Yes, I think if you search suicide in healthcare, almost the entire body of work is on physicians and medical students. And yes, absolutely important. And there's also a lot of other people that contribute to our healthcare system. So I'm so glad that this area around nursing is emerging and growing. And of course, all of that data is prior to the pandemic, which we know had a huge impact on nurses' well-being, and continues to. That is a long tail that continues to impact our healthcare workers.
Yep.
Any other research that you've been paying attention to in this space that would be helpful to share with our listeners?
It's because of all the things that we've talked about, those barriers to help seeking, just the stigma and just a lot of those things that are kind of we have to address. Things like interactive screening programs, like from the American Foundation for Suicide Prevention, have been very impactful in allowing healthcare workers and those who use it to complete a very brief, it could be a depression or just overall well-being survey, to gauge, and to have, okay, am I struggling? Am I in need of support? And there's a way that obviously through an encrypted database can connect people directly to resources in an expedited way. And that's a method that I really value, because what I say is that we have to be able to reach in. We cannot always rely on people to reach out. And that's can't be farther from the truth for nursing and I think healthcare in general.
Yeah, I love the interactive screening program, especially for, the reluctant help seekers, because it kind of in that process of going back and forth, where both parties don't know who the other is, and there you can get all kinds of questions answered without having to disclose who you are. So, is this going to go back to my employer? Nope, it's all held confidentially. Is it going to cost a lot of money? No, it's covered under your employee assistance program benefits it just like helps people weed out some of those concerns so that they can access care when they need it.
Well, and organizations just can't say, here's a card, contact EAP, or employee assistance program. We know, and we have to just, it is out there. The utilization rate of employee assistance programs is very low. And it takes a lot of effort for a nurse to identify and to succumb to the fact that, hey, I'm not doing okay, and then to expect them to pick up a phone, hit the numbers, and it feels like an attorney when you're in an eternity when you're dialing those numbers, and then to talk to a stranger about some of the most deepest things. It's just we have to be able to reach in a way that's impactful, meaningful, not intrusive. And I think the interactive screening program does just that.
Yeah, definitely is a great tool. Again, that any workplace could employ, not just healthcare systems. All right, what about some calls to action? What do you want to say to maybe some other people in the healthcare industry that might be struggling right now, or to healthcare systems, or just to workplaces in general, about the importance of some of these approaches?
And I think it's super important. A call to action, I present to the audience, really relates to the fight for organizational commitments for workplace mental health and suicide research and healing. I tell most of my colleagues that we see each other more than we see our families, and our workplaces become a significant impact on us. And I think that's first off and foremost, is that organizations need to make that commitment. For my fellow colleagues and nurses who may be having a tough time, or really just kind of coming to terms with that, I like to say that, it's okay to not be okay, but it's not okay to not do anything about it. And, there's a lot of resources and help available, that you can reach out to and proactively do it, instead of waiting until you're in that deep rut, and trying to dig yourself out of that rut can be difficult. So proactively doing it is usually the best.
Yeah, great. Yeah, and I think, for all the reasons that, prejudice is a thing, discrimination is a thing. We want systems to change to be more inclusive and welcoming with the voices of lived experience, but we do understand that sometimes old systems are hard to turn around. Having more opportunities for these anonymous and confidential, or outside of your healthcare system workplace support groups and helplines and all kinds of things. There's other options. If you don't feel comfortable going through your employer to get support, there are now other options that you can reach out to, and we'll be sure to add some of those resources into the show notes as well. Are there any other resources that maybe you're aware of that are specifically for the healthcare worker, that might also be helpful to share here?
Yeah, the American Nurses Association has funded through the Nurses Foundation, a great well-being index and well-being resources that are available on their website on the American Nurses Association, and also just a great other peer support option aside from the Wisconsin Peer Alliance Network is an organization called Don't Clock Out. And that one was founded by healthcare workers for healthcare workers. And it was actually created in response to a tragic death by suicide of a nurse. So that's a free service that's available. Again, don'tclockout.org. And it's just, again, that power of peer influence and peer support.
Excellent. Well, Christopher, I'm going to go back and do a quick recap, and then I'll come back to you for some final thoughts and ways that people can reach out to you. So Hope Illuminated listeners, we are here speaking with Christopher Wojnar about the healthcare system and not only its influence in the community, but also thinking about the workforce behind those life-saving service providers. And the fact that there are many that struggle with depression, addiction, anxiety, and suicidal thoughts, and yet they're often not thinking of themselves in terms of the ability to take care of their mental well-being. But also the systems are not always considering their self-care, their need for mental health in the same way they do on how to service the community. Christopher, you shared a beautiful and powerful story of living through your own period of despair and having this post-suicide growth moment of like, well, I guess if I'm staying, how can I serve? How can I make this world a better place? And that's led you into this incredible, I would say, dual role of healthcare service and elevating the conversation around suicide prevention. So you're just helping so many different communities with your work, and we're all so grateful for it. And we also talked about zero suicide. We'll put some more information about that in the show notes. Again, it's a global movement with healthcare systems to improve care in the communities so that no one dies in isolation and despair. And Christopher and I are super hopeful that we can do more in partnership with the healthcare systems to make sure that the workers are also supported. Christopher, what are some parting words, some final thoughts you want to make sure our listeners walk away with?
I think you said it the best. I don't even know if I could say it any better than that. So, I think I just can't believe that, I'm sitting here today doing this podcast. And I think the big thing is that if you are considering, ending your life, or if you're in a tough time, I hope that my experience and my stories, could be a beacon of hope for you, and to keep fighting, and to keep, and then use, if you get into a spot where you can actually use your lived experience to uplift and share to help others. I would say to do so, but definitely to keep fighting and don't give up.
Thank you. Yes, the process of making meaning, I think, is the process of our life story. When we go through difficult times, how do we learn and grow through it? Christopher, this has been phenomenal, and I am so very much looking forward to all the ways that our lives go braid moving forward with all of our shared passion and interests. If people want to connect with you, what's the best way for them to get a hold of you?
Yeah, I would definitely say LinkedIn is probably the best way for me, and it's Christopher Wojnar, Wojnar, and you could probably find me on LinkedIn. Send me a message. I'm usually a good networker on LinkedIn. So
Excellent. Yes, I would say very responsive and very passionate. Thank you to all the listeners who tuned in for this episode. And thank you to Dave for making us sound awesome. If you liked this episode, please leave us a rating and review and share it with others so that we can spread this message of hope. So in closing, open your heart, challenge your thinking, and take action to save lives. Together, we can restore dignity and sustain a passion for living.